All right. Good afternoon, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, and I'll be your moderator. Today, we're joined by Certified Ergonomics Assessment Specialist and Dental Professional Stephanie Botts. Stephanie will discuss ergonomic techniques, stretches, and equipment choices to allow yourselves and your team to practice pain-free. If there are any questions during the webinar, please add them to the Q&A section, and we'll get to them at the end. Henry Schein is not offering CE credit for viewing or attending this presentation, live or on demand. And today's webinar is sponsored by Midmark. Stephanie, welcome.
Thank you so much. Hi, everyone. My name's Stephanie. I'm so excited to be talking to you tonight about ergonomics. One, because I just love talking about ergonomics, but also this course is all about you. So there's a lot of courses out there that we take that are all about the patient, right? As far as implementing new systems or new technology to make that patient experience better. But this lecture is all about you. And I'm passionate about reminding dental professionals that we need to take care of ourselves. We're the only ones that can take care of ourselves and make sure that we're practicing ergonomically to have the longest career that we want to, okay? Because you guys all know this. All too often our careers are cut short because of injury. But honestly, in my opinion, it all starts with ergonomics. So just a little bit about myself. I am a dental hygienist. I've been practicing for 14 years. I can't believe it's been that long. And all of that up until the last year or so has been full-time. Okay, so I've absolutely experienced my own struggles with pain and poor ergonomics. I've had to learn a lot of things the hard way. So that's why I'm really passionate about sharing this information so that hopefully you can avoid some of the struggles that I have had. But I started a company last year called Posture Pros, where I do ergonomic assessments and coaching for dental professionals. So I'm a certified ergonomic assessment specialist. And so now I'm able to go into offices or do this virtually, but I'm observing clinicians as they're working in real time on real patients. And I'm discovering how they practice, what equipment that they're working with, what unique habits they have, because we all have these weird tendencies that we do when we're practicing because we're so focused on our patient, we don't really know what we're doing. And I'm able to show the clinicians what they're doing as they're practicing. And it's such a powerful learning tool when you see yourself in photo or video while you're practicing, because you almost automatically start auto-correcting just from seeing yourself objectively like that. So it's been great. I do the assessments. I come in and do coaching again while people are working on patients. I'm not just there telling you to sit up straight. Okay, that would be very easy for me, but it's not realistic. And so between the two of us, myself and the clinician, we're able to discover how they can practice more safely while they're working on patients. So it's been really fun. I still practice part-time, and then I do my ergonomic coaching the other time. But I love working with patients. I still love being a dental hygienist. I'm able to take that kind of caretaking mentality and help dental clinicians. We have a very difficult job, as you all know, physically, mentally, emotionally. And so I think that we all need all the support that we can get. So I'm happy to do that. And I'm happy to remind clinicians that they matter too. So before we get into tonight's lecture, I just wanted to thank those who made it possible for this to happen. So there's a lot of behind the scenes work that goes into making a webinar like this possible. So I just wanted to thank Henry Schein for their support in putting this on, and also Midmark for supporting this lecture as well. And we will talk about a couple of the Midmark products. They're very ergonomically minded, which is great. I had the opportunity to speak with a lot of them in Chicago at Chicago Midwinter, and they really are putting a lot of engineering and science into their products to make them more ergonomic to take care of dental clinicians. So we'll talk about that as we go through the lecture. And just so you guys know, I have a much longer lecture on ergonomics at 3 hours. And so to narrow this down into like 50 minutes was very hard for me because I think it's all so important. But I narrowed it down enough for the questions that I get asked the most. And so I hope that you guys get a lot of benefit. But with that being said, if you have questions, please don't hesitate to reach out to me. My email address is at the bottom of pretty much every slide. I'll have a contact slide at the end that has all of my contact information. I'm very quick to respond typically, as long as I'm not working with patients, but I want to be here as a resource for you. So please take advantage of that. So in dentistry, we are the preventive experts. So we understand what it's like to have that preventive mindset, because with our patients, we know that if they take these smaller actions now, it will prevent larger consequences later on. Okay, so we're well versed in this. We talk to our patients about getting into their night guard or doing their small fillings or coming in for their rehair appointments because we know from our experience where they're headed if they don't do that. The exact same mentality needs to be taken when it comes to us. So if we're not taking these smaller actions now, such as really being mindful with our posture or with our patient's positioning or stretching or whatever it is, unfortunately, the odds are stacked against us for developing things like injury and needing surgery or extended time off work or disability or early retirement, all of those things that we don't want to have happen. But it all starts with what we're doing on a daily basis. And it's all these tiny little things that we do on a daily basis that will either make or break us. And that's what I want to talk about today. Another thing that we tell our patients is don't wait until the pain starts. So we understand in dentistry, pain isn't necessarily the best indicator of things going wrong, right? A lot of things don't hurt. We wish they did, but they don't. But the same happens with us and our bodies. So we're going to be talking about musculoskeletal disorders, okay? Those are things like carpal tunnel and low back injury and tendinitis, but those are the things that will knock us out in dentistry. But they often start at the cellular level with something called microtrauma, and we can't feel that happening at the cellular level, okay? It has to accumulate to a certain point for it to become symptomatic. So I'm just really adamant on people, whether you're in pain or not, to start implementing these ergonomic principles so that you can reduce your risk of injury. So here's our learning objectives for tonight. And again, it's a lot of information in a short amount of time. So I hope you guys are ready to go. A lot of caffeine late in the day, so I apologize if I'm talking too fast. But again, ask me any questions at the end and I'm happy to answer them. So we're going to be talking about the unique musculoskeletal disorders, or MSDs, in dental professionals. We'll talk about how to incorporate improved ergonomics and some stretches into your daily life. It's not just your operatory life, it's your daily life, okay? And then we'll talk about patient and operator positioning to improve your ergonomics and reduce your pain. And throughout the lecture, we'll talk a little bit about equipment choices as well that can really help you with your ergonomics. Another thing that I'm going to be sprinkling throughout the lecture is just some examples of stretches. So I had the opportunity to sit down with a local PT here in Denver, Colorado. That's where I am if I didn't mention that. But we developed a chairside stretching program for dental professionals so that you're able to implement these stretches and these micro breaks, as we'll talk about in a little bit, chairside. So you don't have to get up off your stool. You don't have to leave your operatory, but you can start incorporating these micro breaks to really help you reduce your pain and fatigue. So with the stretches too, I just want to say they're there to highlight the muscles that are most overused in dental practitioners. You don't have to do these identical stretches that I'm laying out, but really the goal is to highlight the muscle groups. And so any other stretch that you like to stretch these certain muscle groups, just use that, okay? So first off, what is ergonomics? A lot of times when I start talking about ergonomics, everybody sits up straight, okay? Because they think it's posture, and posture is a very important part of ergonomics, but there's a lot of other things that go into it as well. But a really simple definition that I like of ergonomics is it's the science of fitting the workplace to the worker. So we're the worker, but our workplace is everything in our operatory that isn't us. So it's our stool that we sit on. It's our patient chair. It's our patient. It's our instrument. It's our operatory layout. It's how things are organized in our operatory. And the goal is for all of those things to support us, okay? To support us in neutral posture, something called neutral posture, which we'll talk about, and keep us safe. A lot of times though, in dentistry, we go into the operatory and things are just set up a certain way, and then we start contorting ourselves in order to do our jobs, okay? But that's not the essence of ergonomics. We need to flip that, and we need to start with us and get ourselves into our safe, neutral posture, and then figure out how things can be adjusted to support us in neutral posture. So this is our first micro break, and I don't have time to physically demonstrate all of the micro breaks. It would just take too long because we don't have that much time tonight. But you want to make sure that you're stretching out your upper trapezius muscles. So those muscles are the most overworked muscles in dentistry because we're, elevating our shoulders. We've typically got our arms out to the side. We're leaning forward. All of that really stresses and fatigues the crowns. So you want to do a stretch like this several times throughout the day. But here's the key with these micro breaks. They're 20 seconds long, okay? It takes about 20 seconds for the muscle to relax and then for blood flow to start going into that muscle and repairing some of the micro trauma. When I'm working with clients, they do stretch. A lot of them do stretch, but it's for a few seconds at a time. We really need to be deliberate and hold it for at least 20 seconds. Okay, so all of these stretches, just keep in mind that we're holding them for 20 seconds. So for this trapezia stretch, you want to hold each side for 20 seconds. But because these are the most overworked muscle, it's really good practice to stretch this several times throughout your day. And then I have videos. I'll have a slide at the end with all my contact information, including my social media handles. And I have videos of all of these stretches on my social media, just FYI. Okay, so what is the goal of ergonomics? Really, it's to reduce injury. So we're in dentistry, we're prone to injury because we've got poor posture. A lot of times we're overusing certain muscles, and then we've got highly repetitive motions. Okay, so the goal of ergonomics is to reduce all of those injuries. This can be done by making changes to the operator, to the environment, but a lot of times it's both. And when I say injury, what I'm talking about is those musculoskeletal disorders, those MSDs. So let's talk about those. They are injuries or disorders of any part of the musculoskeletal system. Okay, so you could think of the musculoskeletal system as the movement system of the body. So anything it takes for us to move through space, that's involved in this system. And unfortunately, any of those areas can get injured. So yes, it includes muscles, but it also includes nerves and tendons and joints and spinal discs and cartilage and all of that stuff. And that can unfortunately all get injured. There's some other names for MSDs like cumulative trauma disorder or work-related musculoskeletal disorders, but they all refer to the same thing. Now, just a note about MSDs, these aren't acute onset injuries, okay? It's not like when I'm walking my dog Larry outside and I trip over something and I sprain my ankle and I immediately know something's wrong. It's not like that with MSDs because they start at the cellular level, which we can't feel. And it starts with micro trauma, and our body is really good at repairing micro trauma because we're living our lives and we're active and we're doing things and we hurt ourselves. And our body is really good at repairing that as long as it has time to rest. That's another risk factor in dentistry. So in dentistry, we're asking a lot of our bodies physically when we're working. And then if we're not giving it time to rest, then that micro trauma can quickly start to outpace the body's ability to repair it. And that's when we start experiencing symptoms and eventually get injured. So what do MSDs feel like? They don't feel good. You could have pain or spasms. You could also have more neuropathy type symptoms like tingling, numbness, or weakness. You could have issues with, I didn't put it on the slide, but you could have issues with grip strength. A lot of people start noticing that they can't grip things as tightly, or they start dropping things when they didn't before. And I just want to tell you, just based off of my experience, I wish that I would have paid more attention to these symptoms that I was having 10 years ago before, but it was not chronic yet. It was kind of sporadic and it really wasn't that bad. And so I thought I was okay. But these things, if you're having symptoms like this now, I would really stress that you figure it out, go see someone, work on your ergonomics, maybe get some coaching, because these things will not get better over time. Unfortunately, at least in my case and a lot of other people's cases, they get worse. And once you develop an MSD, it's so hard to go back to normal and back to health after that. It takes a lot of time, a lot of work as far as PT and other medical treatments. So it's just much easier to prevent all of these things from happening. So these are the most common MSDs in dental professionals. So we have carpal tunnel. That's still the most common one in dental hygienists. And then we have tendonitis, rotator cuff injuries, tennis elbow, low back injuries, any kind of muscle strains, trigger finger. And just keep in mind, these are the most common ones, but this list is long because our musculoskeletal system is vast. And so this list could just go on and on. But these are the most common ones in dentistry. And why are they so bad? Well, you could have pre-existing conditions that predispose you for developing something like this. But for the intents and purposes of tonight's lecture, we're going to be talking about how you can prevent these with something called neutral posture. These happen because we're not practicing in neutral posture. So we've got our next micro break here, and this is to stretch out the pectoral muscles. So these muscles get very short and very tight because we're leaning forward, we're reaching forward, and it causes these muscles to just be constantly contracted. And while we might not be walking around with pec discomfort, the tighter these are, the more dysfunction you're going to be having in your back. So regardless if you feel any symptoms here in your pecs, if they're dysfunctional, if they're short and tight, it's going to be affecting your back. So it's really important to stretch this out. This is a chair side pectoral stretch that's really easy to do. Again, you're going to be holding it for 20 seconds. I like to stretch them in a doorway whenever I can. I just put my arms on either side of the door and lean forward and hold that for at least 20 seconds. And that gives you a really good stretch too. But why do we want neutral posture? So neutral posture is whether you're sitting or standing, is the position of the body that gives you the most stability with the least amount of muscle engagement. So we want to allow our skeleton to hold us up, okay? We want our bones stacked on top of each other to hold us up in a stable position and resist gravity so we don't fall over. That's what our bones are for. They don't fatigue, they don't get tired like our muscles do. So we want to rely on our skeleton as much as possible. So neutral posture is really easy to evaluate from the profile view. So you want the ear in line with the shoulder. Okay, so a lot of us, because we're in something called forward head posture, because we're in dentistry, we want to bring our head back so that our ear is in line with our shoulder. Okay, and then moving down, we want that in line with our hip. And then we want that in line with our foot if we're standing. So when we get into trouble is when we start breaking neutral posture. We start leaning forward or moving our head to the side or twisting or whatever it is. And so that takes away the power of the skeletal system. And then it puts all of the responsibility for holding us up and resisting gravity onto our soft tissue. And that's not what it's designed for. Our soft tissue and our muscles are designed to move us through space, not hold us in these really awkward positions for hours a day. Okay, that's why we get so injured. Another aspect of neutral posture is you want your arms close to your sides with your elbows bent at 90 degrees. So let me show you what that looks like, as close to neutral as I could get for these photos. But you want your ear in line with your shoulder as close as possible, and then you want that in line with your hip. And again, you want your arms close to your sides. You don't want them out to the side like this. And then you want your elbows bent at 90 degrees. Now, a quick tip for you guys as far as patient positioning, which we'll talk about more in depth in a little bit. But when you're in neutral posture and your elbows are bent at 90 degrees, that's where you want the level, that's where you want the patient's mouth, is at the level of your elbows. That's always a really good gauge for you. So let's look at some of the ways that we don't practice safely. Okay, so some of these high risk positions that we put ourselves in that could make us at risk for injury. So you could have elbow flexion. So this clearly, the elbows are not bent at 90 degrees. The forearms are not parallel to the floor. But if you find yourself practicing like this on a regular basis, or if you find yourself in this position for an extended amount of time, you probably want to rethink that and see if you can adjust your patient. Like obviously in this photo, this is an extreme example, but the patient could easily be tipped back, right? And then those forearms would go back down towards the floor. And then we want to pay attention to our wrist posture. So just my opinion, we aren't able to hold a neutral wrist posture 100% of the time in dentistry. I haven't found a way to do it. Not that I'm like the end all be all in ergonomics, but it's very difficult. But a lot of how I teach ergonomics is about body awareness. Okay, it's not about perfection, but it's just noticing when you're in a posture like this, for example, with the wrist bent. You just want to notice that you're in an unhealthy posture and try to get in and out as quickly as possible, especially if you're not able to adjust the patient at all or yourself to straighten your wrist out. You just don't want to live in a posture like this. Okay, so just being really aware of where your body is in space will go a long way. And then we don't want to abduct our arms, okay, from our sides, the chicken wing posture that we all got yelled at in school. You can have your arms away from your sides about 20 degrees and it won't cause any extra stress like to your shoulders or anything like that. But this is an extreme example, but this is something that I do see pretty regularly when I'm doing my assessments. And this clinician had no idea that she was living in this posture for all day. I mean, no wonder she was in pain. But this is easily fixed by just reorienting the patient chair so that she can get behind the patient, and then lowering the patient so she could bring her arms down close to her sides. And then forward head posture. So if anyone follows me on social media, I've talked about forward head posture a lot, but this is a very dangerous issue for us. So the world at large is getting a taste of forward head posture because of technology like laptops and cell phones. We live in forward head posture, typically in dentistry, okay? So we're leaning forward, trying to see into the patient's mouth. But what happens, why this is so bad, is our heads are very heavy. They're about 10 pounds on average. So you can equate that to a bowling ball, okay? And when we're in neutral posture, our spine is able to hold up our head, and it doesn't have a problem with that. But once our ear starts creeping in front of our shoulder, like what's seen here in the photo, I mean, I'm 3 or 4 inches ahead of my shoulder. That's every inch your ear is in front of your shoulder, that's adding 10 pounds of extra pressure to your spine. So here in the photo, if I'm practicing like this all day, that's basically like me hanging 3 or 4 bowling balls around my neck and working at the same time. That's how much stress the back is under. We don't want that. Also, our body is very adaptable. And so if we're chronically in this forward head posture, our body will start to lay down tissue to hold us in forward head posture. And so if that happens, we're not even able to get into neutral posture, even if we wanted to. I don't want that for you. You don't want that for you. I mean, none of us wants to walk around looking like these, stooped over elderly people, like some of our elderly patients, because even if you ask them to stand up straight, they can't anymore because of their body has remodeled that. So the more often you can just force your head back and remind your body that you want to be in neutral posture, it's going to be easier for you to hold that. So we have our next micro break here, and this is stretching the flexors and extensors on the top and the inside of the forearm. So this is a really important stretch to do. These muscles are very fatigued for all of us during the day. And these muscles get overworked because of something called pinch force, okay? Whether we're grabbing our suction or our air water or instruments or handpiece, whatever it is, it causes a lot of tension in the forearm. And it also causes a lot of pressure to build up in the carpal tunnel. So the more often you can stretch your forearms, the less pressure you're going to have built up in your carpal tunnel and the better you're going to feel. So again, you're stretching the top of the forearm and the inside of the forearm, but you're doing it for 20 seconds each. Okay, so I recommend this for docs or assistants who have been holding a handpiece for a long time if you're doing a longer procedure, because those handpieces are heavy, so you have to grip them pretty tightly. So it's good to do this after that. I recommend it for hygienists who've been doing SRP with a lot of hand scaling to just put their instruments down and really stretch out their forearms. Okay, so let's talk about into the operatory now. So there is a sequence of events that will help you get set up for success. So when you go into your operatory, we're focusing on us first, right? We're not worrying about the patient yet. We're going to focus on us. So when you sit in your stool, you're going to adjust it to fit you, which we'll talk about on the next slide. Once you have yourself adjusted and in neutral posture, then you're going to adjust your patient. So you're going to lean their chair back. You're going to use some cushions to help control the occlusal planes, which we'll talk about in a little bit too. And then you adjust the height of the chair and then the headrest. But again, it's all about starting with us first and then looking at our patient. So when you sit on your stool, so I use a saddle stool here. So I'm shown on the saddle, but the rules are the same whether you're using a saddle or a traditional stool. So you sit on your stool. If you have a backrest, you want to make sure that you feel that backrest in your back. Okay, it does nothing if it's just hanging out back there. So you want to be fully sat back in the stool to feel that contact in your back. And then you want to tip the seat pan forward just a little bit, nothing that's going to make you slide out of the chair, but just a little bit. So that opens up the hip angle, and then it reduces some pressure in the lumbar spine as well. You want to adjust the height of the stool so that your hips are above your knees. So I went to school a while ago, but when I was taught to have my thighs parallel to the floor, and which from what I've heard, that's not uncommon. But at least for me personally, sitting like that in a traditional stool with my tendency to lean forward really compressed my hips over years and then contributed to some of my low back issues. So it's really important to have your hips above your knees so that your thighs are sloping slightly down towards the floor. That's why I prefer saddles, because you're able to do this really easily. And then you want your weight evenly distributed between your butt and your two legs. So you want to bring some of that weight forward so you feel the weight in your feet. We've got very strong muscles in our legs, and so we want to use that. We don't want all of the weight sitting on our butt because that really compresses the low back especially. So we want to bring some of that weight forward. And then again, you want your arms close to your side with your elbows bent at 90 degrees. So let's talk about operator positioning here, and then we'll talk about patient positioning. So how you are positioned does depend on the arch or the tooth being treated. Okay, so it is different. It's not like you're in one position for the entire appointment. And as much as I hate to admit it, sometimes it does depend on our patient's unique needs. Sometimes they are not able physically or otherwise to get into these positions that we need them to be in. Okay, but for the most part, the majority of our care should be delivered from behind the patient. Now, this sometimes is an unpopular opinion, especially for people who have found a position that works for them. And I'm not here to say, no, if 9 o'clock works for you, you have to get at 12 o'clock. That's not what I'm here to say, because it is different for everyone. But the research has shown that the position for us, as far as the least amount of muscle activity and our ability to hold neutral, is behind the patient. Okay. You can use 9 o'clock, but you want to make sure that you're facing your patient directly if you're off to the side of them. A lot of times, especially with hygienists, and myself included, this is how I used to practice. I would be at that 7 o'clock, but I'd be like sitting sideways to my patient. But that's a very difficult position for us to be in because it's all of the ergonomic no-nos in one. Okay, so you're sideways to your patient, which means you have to twist from your low back to face your patient. And then you're typically got your arm out to the side, your head's bent, you're leaning forward. It's just all of these bad things in one. So if you do find yourself that you have to be in that position, sometimes I find myself in that position too when I'm working on the lower interiors, just know this is not a healthy position for me to be in, and I need to get in and out as quickly as possible. And I'll show pictures of these here in just a couple minutes too. So when you're approaching your patient, you want to push your chin back, right, to try to get your ear in line with your shoulder. And if you're using loops, what you want to do is you want to like roll your eyeballs down to look through the scopes of your loops before you tip your head down. Okay, a lot of loops out there, and I'm not going to get on a tangent about loops, but there's a lot of loops that really aren't ergonomic. We're still having to tip our head down, which is not neutral, or we're leaning our head forward. You want to use the muscles in your eyes to look through the scopes of your loops first, and then tip your chin a little bit if you need to. And I promise, getting into that habit, it's really weird, but it'll really reduce the amount that you're having to tip your chin forward. And then you want your arms close to your body and your elbows bent at 90 degrees. So this is a picture of me standing. I do like to stand. I recommend the clinicians stand, not all the time. I like a mix, like a 50-50 mix of sitting and standing. It's really good. It promotes good blood flow, and then it prevents you from relying on one group of muscles all day. And this is why I really like this chair by Midmark. It's called the Elevance chair. So it goes the highest, like if you want to do stand-up dentistry, it actually goes the highest compared to any other chair on the market. And it has a really heavy weight limit. And so you don't have to be afraid of really elevating the chair and thinking you're going to break the chair, because it can handle it. Another thing I like about this is I recommend, that people be behind the patient. An issue with this sometimes if they have rear delivery system or a counter behind them and they can't comfortably get back there. So I regularly have my clients swivel their patient chair around a little bit so that they can get behind the patient. But the issue I have with this is a lot of them have to reach down to a lever that's like under the chair, which is bad for your back to be reaching. And then you have to crank on this lever. But this chair has a really nice electronic lock that you just hit it with your foot, and then you can rotate the chair. Plus this chair, which I thought this was a little silly at first, but I don't anymore, has a massage and heat function. And I thought this was a little just frou-frou. But when I was talking to the ladies and gentlemen at Midmark in Chicago, they were telling me the more comfortable we can get our patient, the more relaxed they are, the more compliant they are, and the more cooperative they are. So I'm all for the massage and heat function now. If anything will make my job easier as a hygienist, I'm all for it. Okay, so again, if you're at that 9 o'clock position, you want to be facing the patient directly. You want to be squared up to your patient, none of the sideways sitting, okay? And there's different things that we can do with your stool or the patient chair to make it possible for you to be sitting in this manner. But most areas can be done from behind the patient. And then again, you can stand or sit. So I'm a hygienist and I don't have a dental assistant. And so there's pros and cons to both, right? There's pros and cons to working by yourself, and there's pros and cons to working as part of a team. But with dental assistants, they want to be really mindful of their positioning. Dental assistants, unfortunately, a lot of them are in quite a lot of pain. And because they don't take themselves into consideration, they just work around the doc or work around the patient. But if you're a dental assistant, you want your left hip about parallel to the patient's left shoulder. And then you want to be seated or standing a little bit higher than the dentist so that you're able to see into the oral cavity. And again, with assistants, I really push them to try to sit and stand, like alternate sitting and standing, especially if they're going to be in a longer procedure. Assistants typically are twisting chronically from their low back because because they're elevated in the stool, their legs won't fit under the patient chair. They're forced to twist from their low back. So if they have a longer procedure, I really try to push them to kick out the stool and to stand so that they can be at that, 3 o'clock or 9 o'clock position, but squared up to the patient and not doing that twisting from the low back. And again, with docs and assistants, don't be afraid to get close. I know sometimes this can be awkward, but if you're really trying to keep each other healthy and safe, you've got to get as close as possible. The closer, the better. And sometimes this does mean interlocking your legs. And again, this can be kind of awkward, but if you guys just have a discussion about it first and don't make it weird and just make sure that you're getting up nice and close, it shouldn't be an issue. But this will really help. The less you're having to lean forward, the better, whether you're a doc or an assistant. And again, you want to avoid that twisting from the low back. So this picture of me on the right, I used to do this all the time, for years. I was saving time, by just reaching behind me, but it did not do my low back any favors. Okay, doing this time after time, year after year, it's absolutely going to damage your body. So, and then the picture here on the left, it's not quite as obvious, but she does have a slight twist from her low back. Okay, she is a tall practitioner. She's got really long legs. Her legs wouldn't fit under the patient chair, so we had to work on that a little bit. But if you find yourself tempted to twist, or if you have things behind you that you need to get, or even off to the side of you, what you want to do is pretend like you're a robot and you want to rotate your entire body to grab the instrument or whatever it is, and then turn back towards your patient. Okay. You don't want to be twisting from your low back. You also don't want to be reaching across your body with either arm. Okay. And that's why it's so important to just rotate your whole body. That's why I like saddle stools, because they're really easy to do this in, or standing. It's a lot easier to pivot. So speaking of low back, I wanted to include this stretch. This is the low back flexor stretch. So this is the only part of my chairside stretching program that you actually have to stand up for. But this feels really good, especially for assistants who know that they have been twisting from their low back, or any other practitioner who's having low back issues. This is a good stretch. So you just stand up, put your almost act like you're putting your hands in your back pockets, and then you just push your pelvis forward. And it's no kind of crazy back bend or anything like that. It's a slight stretch. It's just not an extreme stretch. You just have to push your pelvis forward just a little bit, but you'll feel a really nice stretch and release in your low back. Okay, so let's talk about patient positioning. This is always an issue for us, right? So we've got fully supine, and that's typically used for the upper arch. And then you have semi-supine, which is used for the lower arch. So positioning can be really difficult. I mean, patients can be difficult, but the positioning can be difficult too, especially if you're in a chair that's super bulky or really thick. And that's why I like this chair by Midmark. It's called the Ultra Trim, and it's got a narrower chair back. And so you're able to get much closer to your patient without the chair getting in the way. And then it's really thin. So you want as little stuff in between you and your patient as possible. So if you've got a really wide chair back, you're not able to get real close to your patient because you're running into the chair. If it's a really thick chair back, typically you're having to raise your shoulders or abduct your arms, okay, because of the thickness of the chair. So that's why I really like this chair. Okay, so let's talk about how to position for the upper arch. So you want to recline the patient all the way back into full supine. And just keep in mind, these first positioning tips are going to be for the ideal patient, the patient who doesn't have any issues, that has no problem laying back in the chair, okay? So you recline the patient all the way back into full supine, and then you have the patient scoot all the way to the end of the chair, because you want the top of their head to be in line with the top of the headrest. And then you want the top of their shoulders to be in line with the top of the backrest. And this is so you don't have any negative space at the top of the headrest that you're having to lean over. Also, it's getting their head all the way on the headrest so that when you start adjusting the headrest, you're actually adjusting the patient's head. This is all about controlling the occlusal planes, okay? So for the upper arch, you want the maxillary arch to be at least 10 to 20 degrees behind the vertical plane. So if I'm sitting here and my patient is in front of me, I'm at 12 o'clock, and these are their maxillary teeth, if you can see me in the picture, you want their maxillary teeth to be pointed back toward you as much as possible. I mean, 10 to 20 degrees is just the minimum. If you're a doc that's doing a crown prep on a second molar, or God forbid, a third molar, you want to have the patient, you want the occlusal plane as far back as possible. And that'll make it so that you're not having to lean forward or do this number in order to see into the mouth. A couple things can help you with that. The headrest, if you have an articulating headrest, like what's shown on this chair, you want to deeply adjust that headrest so it really encourages the patient's chin to nod up towards the ceiling. You can use cushions to help with this also. If you have questions about cushions, let me know after. I can't talk highly enough about these. If you are able to put a cushion in the cervical spine here, that gives the patient, it's like a psychological sense of security and comfort. They know that their spine is supported. They know that their head's not going to go flying off once you tip them back. And I promise you, if you start using cushions, the patients will lean back so much further in their chair than you thought possible. So those can help. And then just using verbal cues with the patient. Mr. So-and-so, please tip your chin up to the sky. And if you're adjusting the headrest using cushions and you ask them to tip their chin up, you're really going to get that occlusal plane back to where you need it to be. So once you get the occlusal plane where you need it, then you want to adjust the height of the patient chair so that you're able to keep your arms close to your sides with your elbows bent at 90 degrees and not out like this. So this is that maxillary plane of occlusion. Okay, so it's behind the vertical here. But again, if you're doing a more complex or longer procedure on the upper teeth, you want it to be tipped back even more. And then the lower arch is a semi-supine position. So if you're going from full supine, you want to go about 20 degrees up from that, and that's going to be a semi-supine position. So what we want is we want the mandibular plane of occlusion to be about 30 degrees elevated from the horizontal plane when the mouth is open. So to do that, you're going to take that headrest, you're going to push it forward so that the patient's chin nods towards their chest. And then you could even use a cushion, you could flip it around, because the different, the cushions that I use, it's got a big end and a small end. So if you flip that cushion around, it actually forces the patient's chin to nod towards their chest. And then you could also ask them, Mr. So-and-so, can you please nod your chin towards your chest? And that's going to help you. The issue with this is well, let me back up. So once you have the occlusal plane where you need it to be, then you want to lower the patient chair because you've raised them up a little bit, right? So you don't want to end up practicing like this. So you want to lower the patient chair so that you're able to keep your arms nice and neutral. Now, this can be an issue for patients who are like 5'6" and under, because the chair doesn't go down far enough. So there's a few things that you can do in this situation. You could either stand for the lower arch. You could use a saddle stool, which a saddle raises you up higher, so it's typically not an issue. Or you can leave the patient in full supine, but then just do like flip the cushion around, adjust the headrest, and ask them to nod their chin towards their chest. Okay, so there are options for that. But this is just showing the mandibular plane of occlusion. So you want it to be about 20 to 30 degrees elevated from the horizontal plane. So if you see here, it's much different versus when we're talking about the maxillary to the mandibular arches, okay? And it's not uncommon when I'm going in and working with clinicians that the patient is put in a certain position and then they don't move for the entire appointment. There's no side to side moving. There's no up and down moving. The headrest doesn't move, which is great for the patient. It's very comfortable for them, but it's not comfortable for us. So we want to make sure that we're adjusting the occlusal planes and the headrest and the patient depending on where we're working in the mouth. So speaking of headrest, I just wanted to say this quick note about the headrest that Midmark have. So I tried out one of the chairs at Chicago Midwinter, and I was kind of obsessed with the headrest because it's very concave, and I felt very secure with my head being in this position. So we all have patients who, when they lay back in the chair, they can't find the headrest, or their head kind of drifts from side to side, and we have to keep asking them to move their head to the middle of the headrest. It's not an issue with the Midmark headrest, okay, because it keeps them there, keeps them locked in and nice and stable. Plus, it's really comfortable. So again, these are the different headrest positions for the upper versus lower arches. Okay, so it's much different. And too, when I go in and work with clinicians, they don't know if the headrest moves. They've never moved it ever. So if you have a double articulating headrest, this is a really good ergonomic tool for you. And I promise you, it's going to make your job a lot easier. Okay, so that was all for patients who have no problems laying back. Okay, I do want to touch about challenging situations a little bit because we all have those. Okay, so let's talk about the little ones, our pedo patients. Their bodies do not fit into these big chairs that we have, okay? But the rules are the same, whether you're talking about a kid or a petite adult or, regular adult, whatever it is. So when you lay the kid back, you want to have them scoot all the way to the end of the chair. So when you have them do this, sometimes their entire body is going to be on that backrest, but that's fine. They don't have aches and pains yet. They're still nice and flexible. And for the most part, they're easy to please you. And so they'll do what you say. But we don't want to have that dead space in between the top of the patient's head and the top of the headrest, which I see a lot with pedo patients. Even if you have 2 or 3 inches where the top of the head and then the headrest, you can see some of the headrest there. It doesn't seem like a big deal, but that's 3 inches that you're going to have to make up for, whether you're reaching your arms forward or leaning your head or your body forward. You don't want to do that, especially with kids. Have them scoot back. They're fine. They can do it. You can also use cushions. So here in the picture, she's using a booster cushion, which is great. The booster cushions are great for kids, but then also petite adults or even elderly patients as well. So I really like this. I like and don't like this photo. I like it because her patient positioning is excellent. She did a great job. Her positioning is not so great. So let's just focus on the patient positioning. And then we have elderly patients. These are my most difficult patient population, not because they're difficult, but because they've got issues, it's uncomfortable for them. So for elderly patients, I always use cushions, always on them. I do, especially if I have a patient that legit cannot lean back in the chair, I'll stand. It just helps me. It feels better, and I'm able to maintain more close to a neutral posture in that situation. But a couple hints for you for elderly patients or any patient that you think is going to have an issue with laying back in the chair. Before you even bring them back into the operatory, try to pre-recline the patient chair, just like 30 degrees, just a little bit. So that when they come and sit in the chair, they're already in this semi-reclined position. You're still able to have eye contact with them and talk with them, but they're kind of getting acclimated to being reclined. And that way, when you really tip them all the way back, it's less of a distance to go, which can be less disorienting for them. But I promise you, if you use a cushion, I have had patients who have like severe kyphosis, which is the excessive curvature of the upper spine, and they tell me they can't lay back. If I put a cushion there, they will go almost back into full supine. So I really just encourage you to use the cushion. Another hint for elderly patients or patients who are just going to have a hard time laying back is you start to tip them back in small increments. So what I do is I'm typically talking to my patient about their either small talk or about their hygiene at home, and I'm tipping them back little by little. But I want to make sure I'm having a dialogue with my patient. So I'm kind of distracting them a little bit. They're engaged in the conversation, and I'm tipping them back just slowly. And before they know it, when I'm done with the conversation, they're all the way back into full supine with no complaints at all. So that's, sometimes we just got to trick our patients a little bit. These are the cushions that I've been talking about. So I use them on all of my older patients and then patients who have neck or back issues. I promise you, it makes such a difference. Plus, if you're taking the time to give your patient a cushion or two, they feel pampered, they feel taken care of, and they're much more apt to be flexible with you when you start to put them in these more extreme feeling positions for them. Okay, so we just talked about a lot. That was like a serious, just quick sprint through all of the ergonomic stuff, but that was a lot of information in a short amount of time. So I just want you to start slow. Okay, don't try to go into your next day and like incorporate all of these changes at one time, because if you're anything like me, I'm a perfectionist, and if I don't do things perfectly, I get really down on myself. So just give yourself some grace. Maybe start with one thing and try to master that. Like maybe get some cushions and play around with controlling the occlusal planes, or maybe doing some micro breaks, or really paying attention to your patient positioning. Just take it one thing at a time, and that way you'll be more apt to, get your confidence and feel better. So these are all the different ways to contact me. Again, I really want to be here as a resource for you. We all need some extra support every now and then in dentistry. We've got just a tall order with our jobs these days. So I just want to be here for you. So I've got my website, my email, this is my phone number, and then these are my social media accounts. You can scan the QR code. It'll just bring up a list of everywhere I'm present online. So anyways, please reach out to me. And I just want to thank you all so much for your time. I'm sure that you all work today. And I just appreciate your time and your interest in ergonomics. And again, if I can be of any further assistance to you at all, please just let me know. And that's all for me.
Excellent. Thank you so much, Stephanie. We do have some questions. First one was, any brand you would recommend for the cushions?
So I use MediPosture, MEDI posture. They're really long lasting cushions. You can disinfect them in between patients. The cervical cushions have a strap that you can like attach onto the chair so it doesn't slide out. So yeah, that's what I use.
What about saddle chairs?
I encourage anyone who has questions about saddle chairs to reach out to me. They are not one size fits all. And so it's really, I don't want to just recommend one brand for people because I don't know if that's going to work for them. And so typically it takes a little bit more of a conversation. If you want to know the kind I use for me that fits me and my body, it's Crown Seating. But there's a lot of other companies as well that make really good products. So please just reach out to me if you have questions about that.
What about ergonomic loops?
I'll tell you the brand that I use. There's a few different brands out there. I use Andow Medical. They're the loops that were shown in some of my photos, but you're able to keep your head, in the neutral posture, but the oculars are they've got reflective technology in there, so you're able to see down into the patient's mouth. So I highly recommend those. There's several brands that have ergonomic loops now, but the one I use in the photos is Andow Medical.
Any tips on high suction position of the left arm while we're using an electric scaler?
So that might be something that I want that person to reach out to me for too, because I'm not sure if I completely understand the question, but I'm assuming it's a hygienist. I really like hands-free HVE options, and we can talk about that. I'm not excited about the ones that you still have to hold in your hand because of the weight of the cord and that pinch force, because you're grabbing onto the suction the whole time. So there's some really good hands-free options that I'm happy to go over with you.
Great. And would you mind putting your contact info back up, please?
Yep.
Thank you. Let's see what else came in. What brand of instruments do you use?
Oh, well, okay. So, I'm a little picky on my instruments. I'm sure a lot of hygienists are. I personally love PDT instruments. They're really ergonomic. They're lightweight. I just love the blade on them. I've been using them since I was in hygiene school, and I know the owner of the company, and she's amazing. And so those are the instruments I use. I also use the Harmony scaler from Hugh Freedy. I have a few of those as well that's ergonomically designed. I would say for instruments though, it's personal preference, but you want to make sure that it's balanced, that it's sharp, like really sharp, and that the handle's nice and fat and it's light.
Can you review what was the name of the dental chair?
Oh, my
Elevin.
stool is crown seating.
Crown seating dental chair was the Elevance and Ultra Trim, correct?
Oh, sorry. Yes, patient chair. Yeah, sorry. Yes, mid-mark, Elevance, and then Ultra Trim.
All right, lots of questions. Cushions are the hot topic. All right, so you already answered what kind of cushions. What about where you can find them?
Yeah, so if you actually go onto my website, posturepros.net, I've got a feature like a favorite products tab, and you can just click on that and it'll take you to the site. And they have a lot of different options. They've got cervical cushions, low back cushions, knee cushions, booster cushions, all of that. I would at least recommend 2 different sizes of the cervical cushions. You have a regular one, and then you have a really thick one for like our elderly patients who need that extra support.
Great. And midmark.com is also an option as well.
Awesome.
We are recording this webinar for those of you wondering, so we will get that out to you in the next week. Let's see. Do you recommend any changes to the typical layouts of treatment rooms?
So I would ask that person to reach out to me and we can talk about that. I don't want to get too into it. It all depends on what you're doing. You know, if you're right or lefty, if the room is going to be multi-purpose or if it's just for hygiene or just for restorative. So that's a bit of a longer conversation. So I would encourage that person to reach out to me.
All right. That is a multi-question. I only answered stage 1. So let's see. Please say the name, spell of the saddle chair. So that's crown seating, CROWN, seating.
Yep.
All right. Do you do ergonomic coaching?
Yes, that is what I do. So I do assessments. I can either do them in office or virtually. So I do assessments and coaching. And the virtual option has actually worked out really well. So I'm able to offer that service to people outside of Colorado. But yes, if you're interested in that, please check out my website or reach out to me and I'm happy to talk to you about that.
Where would someone find the videos of the stretches that you mentioned?
They are, I would say they're on Facebook and Instagram. Probably the easiest is on my Instagram. But they're on Facebook too. So either one, or, you know, if you're not on social media, you can email me and I'd be happy to just send you the files that show me stretching.
All right. What are signs of carpal tunnel syndrome?
That's where you have those more neuropathy type symptoms. So you'll having like tingling, numbness, maybe some people get numbness like in their ring or pinky finger. So those are some symptoms of carpal tunnel. It's not necessarily pain all the time.
And as of now, this is the last question, but what are some best practices, health ergonomics? What are some best practices, health ergonomics for procedures with special needs patients?
So yeah, that's a great question. I would say special needs patients are, they can be challenging, okay, for positioning for us. And so if you know that you're in a tough situation where you can't get your patient, you know, if you're kind of fighting the patient or you can't get them in the position, I would say incorporate as many micro breaks as possible. You want to do it like every 20 minutes for 20 seconds, because we're all going to have those times where we just can't get in neutral posture or we're just having a difficult time with our patient. Our micro breaks are our medicine for us. Okay. So if you know that you're in a difficult appointment, that you've been leaning over or like doing all these crazy things, you just got to set your stuff down and take a quick micro break, and that'll help get the blood flow back into the muscles so that you don't feel as much fatigue.
Are there any dental assistant chairs that you would recommend?
So it all depends. Again, it's not the easiest question. The issue I have with some of the dental assistant chairs is because of the flat circle that they're sitting on, right? And their legs are out in front of them and they're not able to get really close to the patient. So there are some saddle type assistant stools, which are nice because they actually get the legs out of the way so the assistant can get closer to the patient. Another issue I have with assistant chairs is that, like, the support there that's supposed to support your arms, a lot of times that can get in the way. So there are some chairs that just have like a support off to the side that you can rest your arm on, but there's nothing in front of you, so you can get much closer to the patient. The one company that comes to mind that has that is called RPG. They make a lot of ergonomic stools, but I really like their assistant stool.
For golfer's elbow or ulnar nerve impingement, is that postural as well?
It could be, or you could, it's tough because it could be postural. It could be the instruments you're using or how you're gripping your instruments. It could be old trauma, that's contributing to that as well. And so that's when it's just hard for me to answer that because I haven't seen you practice and I don't know what your tendencies are, but I would be happy to work with you to see if that's something, that could be fixed with just positioning and posture. But I just want to add with the tennis elbow, a stretch that can really help is those forearm stretches. A lot of times when we start experiencing that like tendonitis in our elbow, it's because our forearm muscles are just way too tight.
Excellent. Well, I'm not. Oh, maybe one more came in here. How do you avoid tennis elbow?
Again, like making sure that you're stretching your forearm muscles, but you also want to make sure pay attention to your wrist posture, and then making sure that you're not abducting your arm out to the side too.
Okay. Thank you. Great presentation. Cool.
Awesome.
I think that is all we have. Any parting final words?
No, I just take care of yourselves, guys. I mean, we're so at risk in dentistry and we are so good at taking care of everyone else. We've got to take care of ourselves to make sure that you have a nice quality of life. I'm all about quality of life and of course, a nice, long, healthy career as well. So put yourself first, please.
All right. Thank you so much. I know I was stretching along with your opening, so I help everyone else as well.
Okay. Well, thank you so much.
Awesome. Like I said, we did record tonight's webinar, so we'll get that out to everyone in a week or so. Feel free to contact Stephanie. Her credentials are on screen there. And if you have any questions, webinars@henryschein.com. Thanks, everyone. Have a great night.
Awesome. Thank you. Good night.